Good morning, everyone. My name is Jeff Kanaj. I'm the editor of NJBIZ. Welcome to our discussion on substance abuse in the workplace. Ordinarily, when I prepare for these events, I have to do some background research into whatever subject we're talking about. In this case, all I had to do was look back on 20 years of experience as a manager. I'm sure many of you could do the same. Dealing with a colleague who you suspect may have a problem is difficult. It's difficult professionally and maybe even personally. It's a stressful encounter, but one you have to get right. It's because it may not just be a matter of someone's livelihood, it could quite literally be a matter of life and death. And your presence here tells me that you understand that, and we're going to try to add to that understanding this morning. Leading our discussion will be Angelo Valente. He's the executive director of the Partnership for Drug-Free New Jersey. Mr. Valente has led the organization since it was founded in 1992, and under his guidance, the partnership was honored twice by the White House, in 2010 and 2015, for its innovative programs. In 2009, he was appointed CEO of the American Medicine Chest Challenge, a national campaign to raise awareness of prescription drug abuse. And since 2000, he's been a member of the Holy Seas mission to the UN, focusing on international drug control policy. Angelo, if you'd come on up, I will turn the program over to you.
Good morning. Thank you, Jeff. And welcome to Substance Abuse in the Workplace, a panel discussion hosted by NJBIZ. I'm very pleased to be moderating today's crucial conversation. New Jersey employers and those throughout the rest of the country face continued challenges on maintaining a healthy and drug-free workplace, while simultaneously, compassionately addressing individuals in the workplace who, because of their active use, might be harming themselves or others. In a recent Quest Diagnosis National Drug Test Survey, the results of active employees showed the positivity rate of combined U.S. drug workforce at 4.2%. This represents a dramatic increase over the 3.5% positivity rate of 2012. A sharp increase was also found in the use of cocaine, methamphetamines, and marijuana. And all of us in New Jersey are keenly aware of how the opiate epidemic is affecting every aspect of our state, impacting many of our employees and many of their families. With this global perspective, we have gathered today a group of experts who provide practical insight and advice on how to effectively establish and maintain a drug-free workplace. We're going to begin today's conversation by asking each of our panelists to introduce themselves and briefly explain how their organization's role is in place to assist businesses addressing substance abuse in the workplace. And we'll ask to start with Kelly, and then we'll go through our panel for a very brief introduction, and we'll talk about some of the very important issues in the workplace. Kelly?
Hi, everyone. My name is Kelly Efchak. I work for Retreat Behavioral Health. We are a primary substance abuse and mental health facility located in Lancaster County, Pennsylvania. One of the ways that we're working with employers is through human resources, employee assistance professionals, or EAPs, and with the families directly. So if anyone is struggling with any kind of substance abuse problem or mental health issue, it might go through the family. It might not be your direct employee. It could be a dependent or a loved one. We'll work directly with the family to help them get into whatever services they may need and be able to access treatment without any barriers.
Thank you, Kelly.
Hi, everybody. I'm Brian McAlister. I'm the CEO of the Full Recovery Wellness Center, a licensed ambulatory care facility in New Jersey, specializing in drug addiction. I'm also the inventor and CEO of Freedom 365, which is the world's first recovery system on a digital platform that's completely closed loop. It's a way for people to get involved with recovery that can't take off time from work, don't have good health insurance, and don't want to raise their hand and tell their HR, all these other things that go around. So it's a way to get people involved early on in recovery and educate them as to how to get sober. I'm also the #1 best-selling author of the Amazon book Full Recovery, which I've left a couple of copies outside if everybody wants to take one with them. And it's on how not just to get sober, but how to have a great life, a better career, better relationships, and how to really take the most out of all this country has to offer.
Thank you, Brian. Please.
Hi, I'm Christina Stoneburner. I'm a partner at Fox Rothschild. My practice focuses predominantly on management side employment law. So about half of my practice is preventative counseling, that sort of thing, talking to employers that have issues, and I do frequently get issues regarding drug testing programs, the employee that they suspect is under the influence or has a drug problem. So I advise on a lot of those situations.
Good morning, everyone. My name is Dawn Belamarich. I am our Executive Director at Recovery Centers of America at Lighthouse. We are a full treatment center, substance use treatment, located in Mays Landing, New Jersey, so a little bit down the parkway from here. But we provide inpatient treatment, so we have 133 beds, and we also provide outpatient treatment for those coming in with substance use. So from an employer perspective, we're really helpful in not only helping identify and help the employer with getting one of their team members into treatment, but continuing the treatment and ensuring that our patients get a full continuum of care.
Thank you. As you can see, we have a very wide perspective on this issue with the panel that we've assembled today, so I think we're going to have a wonderful conversation and great information that will be disseminated. Now that we have a better understanding of the background of our panel and their organizations, let's begin our conversation this morning by discussing how substance abuse in the workplace affects the bottom line of every business, and how important is it to address comprehensively substance abuse, including the development of a policy in your workplace. Anyone like to begin?
I'll go ahead and start, at least from the policy standpoint. There's a couple things to keep in mind. First of all, if you are going to have a drug testing policy, you should have a written policy. In New Jersey, you're allowed to have drug testing policies. You're very limited on when you can do random testing. But you can have reasonable suspicion testing or pre-employment testing. But one of the concerns that comes up in the case law is privacy concerns. So you have to let employees know that they may be subject to testing. And in order to have that, I think that's one of the big issues. I think the other thing to keep in mind is making sure that supervisors are sort of aware of the costs of drug use in the workplace, so productivity issues. One of the other big issues that comes up that you have to educate supervisors and sometimes HR about is whether or not leave might be available to attend treatment and those sorts of things. So those should all be things that you're considering in your policy too. What's going to be your disciplinary practice if you do have somebody that's under the influence? What are you going to do if you're not FMLA covered about leave situations?
Thank you, Christina.
Yeah, I'd like to piggyback off of that too. Some of the issues with the bottom line are health insurance. Somebody who's got a drug and alcohol problem uses 7 times the health insurance as somebody who doesn't have a problem. I mean, that's an incredible cost to any business. And the amazing thing is their spouse uses 3 times the health insurance because they're worried to death about their loved one, their child, somebody they can't focus on their job. The productivity was mentioned. Statistics show that about 35% drop in productivity occurs from someone who's got a drug and alcohol problem. So this is really costing our business community, like in ways like that are really typically not known at the level that it's costing. So.
Now let's explore the signs and symptoms of substance abuse. What do we look for and how do we find them?
So I think Brian and Christina laid out really, a picture for everyone as to what the costs are for businesses. So I think a lot of times I get questions from employers and business owners, what am I looking for? What does substance use look like? How will I know if someone is struggling? And really, I always tell people to look for changes in behavior, extremes. Someone who was always on time for work is now showing up late. Someone who's calling out significantly. Someone who is having more time where they're taking off or they're using more of their, medical time to go to medical appointments. Someone who was very productive, always had their hand up, was always giving feedback and input, is now, radio silent, really not able to participate as much. So I think, if I know any given time, I think latest statistics is upwards of 85% of the individuals that need treatment in this state are not receiving it. It tells me that there are people that are suffering in silence. So much to Brian and Christina's point, it's really important that employers have policies, procedures, and protocols in place. But, the beginning stage is identifying that someone needs help at all and recognizing those signs and knowing that even having that initial conversation and that early intervention is the way to kind of move forward in a positive way.
And how important is supervisory training in identifying those signs and symptoms?
I think, I mean, from a legal standpoint, you can have challenges to testing programs. Medical marijuana confuses people a little bit because it is prescribed, but even if it's a prescribed opiate, do you have a disability issue because somebody has a disability? So there becomes a fine line between, are you acting because you think somebody was impaired, or are you acting because you think they have a disability? The latter is certainly you're entitled to discipline somebody for it. I mean, the former, rather. The latter, where you're acting because of somebody, you think somebody might be disabled, could lead you to discrimination claims. So I think it's very important that, especially if you have a reasonable suspicion testing program, that supervisors are trained on what they're looking for. And a lot of the things that I tell supervisors and management are the things that Dawn mentioned, is looking for changes in behavior. You know, you might have the obvious odor of alcohol, you might have dilated pupils and the obvious sort of physical characteristics, but oftentimes it's a steady progression of a slip.
Right.
It's not all of a sudden today they come in and they're drunk at work or they're high at work. It's that you've noticed over the weeks that there's been a slip in performance.
Okay. Christina, you mentioned drug testing. What are the legal ramifications of drug testing in New Jersey? Can any employee be drug tested pre-employment?
Yeah, any employee can be drug tested pre-employment. You do need to be consistent. You can't sort of pick and choose. You can't just say, I don't like the looks of that applicant, I'm going to send them for a test. You have to have a formal program that says that you're going to test every applicant for that position. If you choose to only do certain positions, that's fine, but you have to designate it by positions. So certainly pre-employment testing is okay. Reasonable suspicion testing is always going to be approved. Random testing, so you know your name gets picked out of a hat. There are federal regulations, so if you have DOT drivers that drive trucks and big commercial vehicles, you're required to do random testing. Otherwise, you can really only do random testing if somebody's in a safety-sensitive position. So you can't suddenly randomly test your receptionist, but you could randomly test somebody that's driving a forklift in your warehouse.
And what is a safety-sensitive position?
It's unfortunately not very well defined. It's defined mostly by case law and sort of what it looks at. So you have to look at what are the risk of harm to themselves or to other people. These need to be more objective considerations, because if you're assuming somebody might hurt themselves, that doesn't make them a safety-sensitive position. It is typically things like operating heavy machinery. If you're working on, say, a production line, something like that, where there's a likelihood of injury, even if they're not a commercial driver, but let's say they drive a van, you know, maybe they're driving your employees from one location to another. So even though they're not a commercial driver subject to DOT regulations, those would be examples of safety sensitive.
And are those positions that need to be identified in the policy as being safety sensitive?
Yes, I would, if you're setting up a random policy, you should identify them. First of all, everybody has to be given notice that they're going to be subject to the random testing, so that's why you want to identify it. The other issue is, in order for random testing to be upheld, if it is permitted and safety sensitive, it has to be truly random. So you need to know who your pool is, because you've got to set up a pool. If you do have DOT drivers, that's got to be a whole separate pool. You can't put your DOT drivers and your non-DOT drivers in the same pool. So you have to be able to demonstrate that this is truly random, or else you're going to get complaints from employees that, like, I got picked 6 times for drug testing and nobody else got picked. So you really do have to make sure you have a random pool.
Yeah, I'd like to say something on that too. One of the main populations we serve in our treatment center is first responders, and we all know that Governor Murphy just passed a law that our state troopers are going to be tested twice a year randomly, and of course our business has gone up due to that, because addiction is not a socioeconomic respecter. Anybody can have it. We all know somebody in the room who suffers from it, whether it's in our family or in our workplace. So, the idea with this is we want to make sure that everybody has the opportunity to get well. Part of the problem is what Angelo mentioned in the beginning, that, dealing with a colleague who has this problem can be stressful, and people get very uncomfortable broaching the subject. part of what we do with this Freedom 365 program that we've developed is we provide our employers an assessment, a very soft sell assessment that somebody could take. It could be part of their health or wellness package, not just their insurance package. So they can go there and raise their hand in anonymity in their own bedroom and take this assessment, rather than come to their HR or come out here and be stigmatized that they think they may have an issue. The whole idea is we're going to have to start expanding solutions and start looking outside the box, because right now, if you look at typical statistics nationally, 80% of the people that leave a treatment facility relapse in the first month. You've just invested $30,000 to $50,000 in this person to try to help them get well, and it was like taking the money and lighting it on fire. So the idea, we're looking at out-of-the-box solutions and taking really an entrepreneurial attitude into such a stigmatized and often misunderstood disease.
So if an assessment reveals that an employee has a problem, what kind of treatment options exist for employees?
So from a treatment perspective, and just going off of what Brian said, because I think a lot of employers feel very alone, or kind of out there trying to figure out, how do I have this conversation? How do I empower my leadership to have these conversations? From what Brian said to what experts in the treatment world are doing, we can come out and provide training. We do luncheons all the time. We can educate leadership, but once the individual you're working with finally gets into treatment, there's a variety of levels of care that they can go into. So least restrictive would be, your general outpatient programming, where they're living at home, they're going to treatment, they're getting group and individual counseling, random drug testing and things like that, all the way up to, a detoxification program where they're really medically monitored in the safety of a treatment center. So it can really, there's a variety. I think a lot of the questions I get a lot of the time too is people's assumption is that when they call 1-800-RECOVERY or wherever everyone is providing treatment, that they're going right into a facility. This is like a standard theme that people have, and really it's based on criteria. There's information that is gathered to determine what is the best level of care to get that individual well. And we work directly with the employers. We have customer relations managers. We will, when the individual's in treatment, there's constant communication. And like Brian said, our goal is to help people get well and then help people stay well. So really a full continuum, whatever creative and innovative ways we can work with that individual so that when they return to work, they're able to maintain sobriety and recovery.
And Kelly, what about the difference between outpatient and inpatient treatment? Are there options available for employers?
Of course, there's a ton of options available for employers. There's outpatient services, in case anyone's not familiar with what outpatient services are. There's general outpatient, where someone might just go somewhere once a week, maybe for an hour or so, to meet with a private therapist. There's also intensive outpatient, which could meet 3 hours a day, potentially 3 days a week. So that's something that someone could do after work, maybe from 6 to 9 in the evening. There's also partial hospitalization programs, where someone that might need a little more care while they're still living at home, they can go to a partial hospitalization program, maybe 5 days a week, 4 to 5 hours a day. So there's a ton of options for families, for employers and employees. It doesn't mean that you can't work to get treatment. A lot of the times that's something that people believe is impossible. You can still get help while you're working. We don't want people to lose their incomes and not have money to support their families. That's not what we're looking to do for people. So there are options, and I think one of the hardest parts about that is asking the questions. A lot of the resources in someone's employment, they don't know the answers. So what we try to do as treatment facilities and providers is be that connection for you as well. So if you have any questions, it might not be about a particular person right away, we're there for your support as well.
How important is it that we treat all employees equally? So if there is an employee that's on the assembly line versus someone who's in the executive office, do we have to treat them equally?
You can differentiate by position. I would argue that although there's a risk of injury that's present for somebody on an assembly line that's not present for somebody on an executive, you have similar work problems, though, with those individuals not performing. You do have to be careful that you're not targeting just one person, because that leads to discrimination claims. So under the law, you could say, I don't like somebody because they're wearing, a yellow top. That's legal. you can't say you're going to do something against somebody because they're in a protected class. However, what happens if people feel that they're singled out is they very oftentimes say, well, it must be because I told you last week that my husband is dying of cancer and I'm going to need leave. It has nothing to do with the fact that everybody, I'm taking 2-hour lunches and I'm showing back up slurring my words. It has everything to do with that protected class. So you do have to be somewhat careful about how you're applying the policy. And I typically say if you have a disciplinary policy, it should uniformly apply. So if somebody violates the policy because they are impaired at work, what you do for that person is what you do for every person. So I have employers that do everything from no tolerance to, they have termination, to they have, we're kind of going to work with you. We're going to have a last chance agreement. You're going to sign it. You're going to agree to go get assessed. We're not professionals as the employer, so we don't know if you need inpatient or outpatient. You're going to go get assessed, and you're going to do whatever they tell you to do with the assessment. And you're going to give us permission to get information from the treatment facility, not about specific details about their medical condition. It's, are they compliant with the treatment? What's the treatment recommended? Are they being compliant? And, in some cases, I have employers that will subject that person on a last chance agreement to random testing for a period of about a year or 2 years.
With regard to treatment, there's a lot of discussion about medically assisted treatment. Could everyone talk about how that plays a role in your organizations?
You want to go first?
It's up to you. You can go for it. Go ahead.
Medication-assisted treatment is something that is actually giving people an opportunity to get back to work, get back to their family. It's something that it doesn't cure your disease, it doesn't cure your addiction, but it's something that can give you that extra little bit of help when you're in the beginning stages of recovery. There's a variety of forms. There's injectable versions of medication so that someone doesn't have to take something every day. It lasts 28 days. There's different types of oral medication that someone can take. There's medication for smoking. If you're quitting smoking, there's medication for helping you, quit smoking and make it a little bit easier on you in terms of cravings and urges and being around relapse triggers. And at Retreat, we utilize a variety of forms of right now, one of the most popular injectable versions is called Sublocade, and it's something that is giving people a really good chance to kind of just get their feet planted and get back to their responsibilities while still getting treatment. We don't suggest that you utilize medication-assisted treatment without actual treatment. Mm-hmm. So we do want you involved in some sort of level of care.
I think from an employer perspective too, Medicaid-assisted treatment is becoming definitely something that's more prominent and you're going to hear more about. The idea is really that the individual is taking something daily or maybe getting an injection every 30 days, but then they're in some type of therapeutic counseling program as well. So the idea for an employer that, if you're doing random drug testing or if you're doing things like that, it would be similar to somebody taking daily diabetic medication, and really, Brian's point of the innovative, if we're not helping the problem right now, are we thinking outside the box to come up with solutions so that we can help people stay well? Medicated assisted treatment is not a new concept, but it's really becoming at the forefront because it is helping people stay well, and helping people work a program of recovery. So it's something to be cognizant of as an employer and as a business owner, because it is something that, we are introducing to a lot of individuals coming in for treatment.
I just want to add one thing to that with regard to the drug testing. So I have had this call before, and quite frankly, I shouldn't have gotten it because the medical review officer should have caught it and not sent it to the employer. So what normally would happen is that your test is positive. So if you're testing, usually most people are testing for PCP, methamphetamines, cocaine, opiates, and marijuana. Those are usually the big 5 that everybody's testing for. If they come back with a positive, let's say opioid result, the medical review officer should reach out to that person and say, do you have a prescription for this? I need proof, whatever. If they get proof of the prescription and that explains the test results, then it gets reported back to the employer as a negative test result, and you should never know that even occurred. The same thing, I actually got a question with methadone. So methadone shows up like an opiate. But there is a very specific test to determine if it's methadone versus heroin. So you want to make sure, and we wound up getting the medical review officer on the phone, and he's like, no, we ran the second test, it's methadone, and so I'm going to report it as a negative test. And that was something the employer didn't understand. They're like, why is that a negative test? I'm like, because it's a prescribed medication that they're taking lawfully. Mm-hmm. So it is something to be aware of.
So if an employee is being tested, should it be done in-house or should it be done by a service outside of the
No, it should always be done by a qualified laboratory. First of all, you can, and I do have a couple of employers now that are trying to deal with the situation. They have very remote locations, so they need somebody that's qualified to take a urine sample. They have to be specially qualified, so they have to be your supervisors would have to go through training. They have to understand what's the conditions that ensure maximum privacy for the individual, but also chain of custody of the sample. For the most part, you're going to want to just send them to a laboratory facility to get the testing done there.
What's the role of EAPs in the workplace, in particular dealing with this particular issue?
I know for my clients, not all my clients have EAP programs with their health insurance. It is certainly something that's available, definitely with larger employer plans. It's oftentimes put in. If you're self-insured, it's something that usually comes up with your broker as well, because it's a great way of reducing overall health costs as an EAP. It is an employee assistance program. It is, and your employees sometimes are scared to use them because they think their boss is still going to know everything. Under HIPAA laws, your boss can't know that you went to the EAP program, and it's actually not a claim that gets put through to the insurance. So even if you're administering your own claims, so you see the claims coming in, the fact that they called the EAP program, they're going through counseling with the EAP program, doesn't show up as an actual claim. It's a separate cost that you're paying for in the insurance.
And the great thing about an EAP is that that is the point of contact for the treatment provider on behalf of that patient while they're in treatment, that individual, your team member. So again, to Christina's point, your supervisor doesn't know, your boss doesn't have to know, it doesn't have to be public knowledge. It's really coordinated through that EAP, which is a great advantage of having one, because then they're kind of the intermediary to make sure that that individual is getting what they need.
And another option is teledocs. If some of your insurance, our insurance has it. I know my firm's very big on wellness programs and things like that because we are self-insured. So it's a big push, and they just went to teledocs a couple years ago, which is another option that you can provide, that somebody can actually call up a doctor and say, hey, this is what's going on. Most people are going to use it because, my kid fell down. I don't know if they need stitches. Should I take them to the emergency room or not? It avoids a lot of those emergency room claims. But I also feel like some employees might use that teledoc option to talk about, are there maybe treatment options, those sort of things that they wouldn't maybe go through a formal EAP program for as well.
What we got going on with the new product we've developed really is the next extension of teledocs, because what do we do now? We use Google, right? We don't call up and say, hey, I want to know what's going on with every question I have in life. We type in a word, a phrase, and it gives you solutions. That's what this thing does. Freedom 365 it's really an extension of that. It's the idea is to catch somebody on the fourth floor. Am I having a problem? Am I recognizing something in the workplace? Am I seeing something in my child that may be addiction? So I can type this in, and it will give me hundreds of solutions and measurable actions I could take that are metrics driven, and give somebody an opportunity to get off on the fourth floor, like I said, before they hit the basement with full-blown addiction and wind up in a treatment program. The idea is they might wind up there anyway, but this is a soft sell. It's an educational way. It's a way of backing in and recognizing there might be a potential problem.
Now, many of the people in the audience are small business owners. What about the cost? Is it cost prohibitive to participate in EAPs or in any of the programs that we discussed so far?
It depends. A lot of small businesses have, you can get into sort of group programs. So although it may be prohibitive to insure your business with Cadillac insurance and that sort of thing, if you get into a pool of insurance, which they have them for small insurers, that becomes a lot more affordable as well. I think, from what I've seen and what I've been told is if you measure the cost of the EAP versus the cost of the healthcare claims, the EAP more than pays for itself.
And think what it costs to train an employee. You've got a good employee. You've got some time invested in them already. and they're productive. If they were sober, if they were able to get well, would they be willing to keep them? Would you want to have them on your team? These are questions you have to ask, because I know I was in a retail business, a Fortune 100 company, where I was a regional manager for them, and it cost, for a $10 an hour employee, the first 6 months of that employee's time were spent really the company to make a dime. So if we're turning them over, because you have to get them in health insurance, you have to train them, by the time they learn their job. The idea is we want to save these folks, and we want to save the company money. That's really what the goal is here. It's really good business to help your employees stay well in the long run, insurance-wise and many other ways.
Kelly, what are some of the gaps between treatment and employees?
So a lot of what was just mentioned is something that we are interested in kind of bridging. That gap is, most people are coming, the EAP gets involved after they get in trouble. So they've had an accident, they've gotten injured, they've come to work and they were intoxicated. Some of the things that we're looking to do is train the organization as well as the employees that we want to be able to identify the signs and symptoms. We want to get an early jump on things so that hopefully someone can get help before they actually are threatened with losing their job, or they lose their job, or they injure someone else. I'm actually a substance abuse professional, so I'm qualified to do those DOT evaluations that we're talking about. Most of my clientele are coming to me after something's happened. So they've been tested in their random pool, and they've come up positive, and they need to go get an evaluation. The only thing they need to do is get that evaluation at first, and then they're stipulated to whatever the recommendation is, whatever level of care they fit the criteria for. So one of the gaps is a lot of people go for an evaluation, and then nothing happens. And not just in the DOT area, but they would say they went for the evaluation, and then no one follows up on what that person's supposed to do, and then it just kind of falls by the wayside. So we want to help people continue through with that. So if you guys are seeing somebody early on and you want them to get that help, we don't want them to fall through the cracks. We want to make sure they get the help they need, and then they can be a value asset to your employment.
I think one of the other barriers or limitations that employees will talk about is the cost for treatment, the accessibility to really get into treatment. So with your insurance panel, there's a lot of in-network providers. Recovery Centers of America provides in-network, treatment for every patient coming through the doors. It's reasonable out of pocket. The deductibles are reasonable. It's not, individuals don't feel like they have this huge amount that they're responsible for when they get out of treatment, which is just a heavier burden. So this is something to explain, to the individual, if treatment is something they're working towards, that there are options that are reasonable, that are cost affordable, so it's not an additional barrier prior to them even entering the doors.
I think there's also just making sure people are aware of the benefits that are available, because as Kelly was saying, a lot of times people are coming to an EAP program because they're being forced by their employer, or you're sitting down to have the discipline conversation because the productivity has slipped and they finally say, hey, I've been struggling, I have this issue. So they get referred to an EAP program. So they're already pretty deep into their problem by the time they go to the EAP. So a lot of it is just educating your employees, like, these are the benefits that we have, this is what's available. And I'm not trying to make a plug for this particular app, because quite frankly, we just started it, so I don't even know if it's great or not. But there's an app called Castlight that our firm just started to use that literally has all of your benefits in one place. So you go in there, it tells you what your dental benefits are, the EAP benefits, the teledocs. It's funny because things that, just not health related, we have a benefit, you can get discount on Broadway tickets. I've known about it for years, but since they did the Castlight thing, I can't tell you how many people in my office were like, you can get discounted Broadway tickets? I'm like, don't you get the emails every day? So a lot of it is just educating them on what's available for benefits.
How do we deal with disciplinary issues in the workplace?
It becomes difficult because you do have to be concerned that, alcoholism is a protected disability. Being a recovering drug addict is a protected disability. What's not protected is you're in the middle of a bender. That's not protected. But there are protections under federal law and state law for a recovering addict. So you do need to be careful because there are regulations under the Federal Americans with Disabilities Act as to when you can get what's called a medical examination, and asking somebody Do you have a medical condition? Is a medical examination under the regulations. So you would tend to, what I tell employers is you have to deal with it. You may suspect that it's a substance abuse issue, but you have to deal with it solely as a disciplinary issue. If the employee volunteers, hey, I'm having these issues, or then you want to talk to them about, how many of you have more than 50 employees? So about half. You're covered by the federal FMLA, which it's required to give them leave under the FMLA if they need treatment. So you may want to offer them. You know, you have FMLA options, you have these options with the AAP. You're still going to deal with the discipline on a separate issue. They're still going to be expected to perform their job. But now you've at least had an opening to refer them. But unfortunately, sometimes employees just won't admit they had the substance abuse problem, and you unfortunately just go down the disciplinary path and you wind up terminating them because they never admit that they have a substance abuse problem.
Yeah. And all of this information has to be in the employee handbook and employee manual and substance abuse policy within the workplace. And for those of you who don't have a policy, the Partnership for a Drug-Free New Jersey offers assistance on how to establish and maintain drug-free policies. It's a free service, and Bill Lillis, who's here today, has information on how to get access to that. And also what we do is we provide updates on a quarterly basis on legal issues that will change policies or must change policies.
Right.
Maybe we could talk about how important it is to keep that policy updated.
Yeah, and I think one of the things to also keep in mind, most of you probably know if you are a government contractor or you're a bank or something like that, you're actually required by law, by federal law, to have a drug and alcohol-free workplace policy. You know, this is a great resource to get a draft policy as well, but even if you look at the Drug and Alcohol-Free Workplace Act, it'll give you guidelines for what should be in a policy and what shouldn't be in a policy. Interestingly, it doesn't require testing, but it certainly encourages employers to do testing as well. But it is definitely something, if you are wanting to say that you're going to accommodate people and you're trying to encourage them to accommodate people, then you may want to put right in your substance abuse policy, if you feel that you have an issue and you bring it to us before you're in disciplinary problems, you know, it's a no harm, no foul situation. Like, we're going to send you, you're not going to get disciplined, that sort of thing.
And I think the conversations are key. This is something I see people get trapped in a lot. You know, I've had a million of these conversations. If you let it kind of go and pretend it's going to go away, and then we're just going to progressively discipline people to the point of out, you know, having the conversations initially and having all your leadership, your human resources team aware of what language to use and documenting the conversations that you have is really, really important, because the goal, listen, if someone's struggling, the goal is to get them help. But the longer you wait in that, then you kind of get wrapped up in you're 6 months down the road and you didn't address it initially. So understanding the language to use, how to deliver it, what you're looking for, it's really important because it helps you kind of get it right at the top instead of waiting till it progresses down the line.
How does stigma play a role in this with regard to addressing this issue in the workplace?
Well, this is a very stigmatized topic. Spoiler alert. But, you know, I think it's becoming the opioid epidemic. If it did anything, it made it mainline news. So everyone is aware that there's an epidemic, that, you know, everyone now, I'm sure in this room, as Christina pointed out, and Brian, and have been impacted by addiction and the disease itself. So I think it's really important from an employer piece, you know, because I'm a therapist, but I'm also, you know, responsible for an organization, is to separate out the feelings you may have from it and understand that if people are struggling, people are struggling. And the first goal as human beings is to help people get help. But I think we have our own, you know, society and individually just our own preconceived notions of what it is or what it may look like. And really, I'll go back to the initial conversation, because I see it time and time again where we don't have it because we don't know what we're even looking for. So, you know, getting the education and really putting how you feel, or, you know, how the stigma of addiction has traditionally been, to the back burner, so that you can just, you know, help that individual. Or if it's going to be discipline and progressive discipline, then that's what it's going to be. But having those conversations throughout.
I think it's also an issue of an individual versus a group. Mm-hmm. I think there's a lot more stigma when you don't know somebody personally and you're just saying as a group, you know, drug addicts are bad or alcoholics are bad. And then when you have a human being who's actually sitting in front of you, that's a lot different. And I think you can see it even on social media, like people, how much they judge anytime there's a story about somebody overdosing in like a bathroom at a fast food restaurant, and you see all the comments, but yet their family member's suddenly an alcoholic, and suddenly they're the most educated person in the world about treatment. So I do think you have to battle that.
Yeah.
Brian,
I'd like to say something on that, if I may. I'm a recovering alcoholic and drug addict. Okay, I'm sober since 1990, August 2nd. All right, I'm a CEO. I'm a best-selling author. I've eaten at the Salvation Army, guys. How's that? What you're looking at, alcoholics and drug addicts have some special characteristics that few people don't have. We have an intense, single-minded focus to accomplish a task when we want to accomplish it. I would crawl across hot coals on my face to get what I needed at one time. And now I've taken that same skill set, I've stayed sober, I've educated myself, and I use that same skill set and I point it towards my business dreams, my personal dreams, my family dreams, and my relationship dreams. So alcoholics and drug addicts can be some of your best employees. I know I have several of them that work for me. And they can be also people who are the most loyal people that you will ever find if you give them the opportunity. I'm not saying that they're people like everybody else. There's some good, there's some not so good. But the idea is if you can get somebody who is ready, willing, and able to take certain actions on a daily basis to stay sober, you will find you'll have a loyal employee who will go to the ends of the earth to help your business succeed, because that's what I have in my own business.
Thank you, Brian. Kelly, is this a moral failing or is this a disease?
It's a disease. There's so much more going on here than anything close to a moral failing. One of the new initiatives are stories of recovery. So even if you just Google stories of recovery, you'll see individuals sharing their stories so that we can help reduce this stigma. I don't know if anybody saw Wendy Williams just made her announcement. People struggle with mental health and substance abuse, and they need help just like everyone else needs help with different diseases. But we've literally, this is the most out of probably over 15 years in this industry. I think this is the most we've ever discussed any of these things in multiple settings. These types of panels were unheard of years ago. We didn't do this with employers. Employers did not want to know this information about their employees. So this is a big step in the right direction.
Okay. We've spoken quite a bit today about addressing employees with substance abuse disorders. How do we incorporate prevention? How do we incorporate prevention and recovery programs in the workplace, long-term recovery?
So I think we touched on this a lot, and would love to talk after about resources that we can provide, because training and education is at the forefront of how you can ensure that everybody is moving in the same direction in your organization. So I know for us internally, we do trainings all the time. These are the new evidence-based practices that are coming out. These are new treatment modalities. This is what to look for, because like any other disease, it changes, it evolves, it grows. But I think the number one component I'd say is everyone being knowledgeable about what you're looking for, about how you can help, what your policies are. Time and time again, organizations will have an incident come up and there's no policy to tie it to. And, that's really where you run into having problems if you don't catch it ahead of time. If everyone's moving, all 50 employees, 100 employees moving in the same direction with the same information, regular trainings, then that's the way to really stay ahead of, what could potentially happen in your business.
Kelly, do you also want to talk about that particular issue?
I think we've covered a lot of the resources that are available. We participate more in the community. At Retreat Behavioral Health, we've just really started getting more involved. We want to be that resource. It doesn't mean that you have to come to treatment. We just want to be able to provide the trainings. Certain professionals need CEUs, doctors, nurses, clinicians. Everybody needs to keep their license up to date. So we want to be able to provide the most up-to-date trainings we can so that people have the information at their fingertips.
And what else could we do to foster healthy environments in the workplace? What kind of programs could we implement in order to avoid some of these issues that we have in place?
I was going to say, I think there are a variety of things. Not every addiction is caused by a mental health issue, but sometimes they do come hand in hand. So I think there's also some programs that can be sort of overall wellness programs for dealing with maybe stress in the workplace, family stressors. I know our office does yoga, once a week. I'm not saying everybody has to do yoga, but I know some of the other offices actually have meditation classes that they started offering. And it's something, the firm pays for out of our wellness budget. But even having those sort of realizing, obviously meditation is not going to fix an addiction, but having that sort of idea of being aware of what my stressors are, how I'm going to react to those stressors, I think helps a lot.
Yeah. And to piggyback off of that, I mean, we have meditation internally. We also implemented these debriefings, like sessions. And really, it's where members of the team can come in and be like, I'm stressed out, here's what's going on, like, talk about it. I think it really is a culture. If you have a culture where people can readily come forward, you've made some investment in wellness, they can be open and honest without constant fear of punitive, because I think in the job, a lot of the times people feel like if they come forward with things, there's a write-up, there's a verbal, there's progressive discipline. And not that doesn't happen, that's the nature of the beast. But if you create a culture where people feel they're having a problem or they're having a stressor and they can come forward and there's options, I think that helps employees succeed and know that they're in an environment where they're cared for. And if they're going through something, that there's options to help them get well.
I think one of the other things too is to make sure that you're maintaining confidentiality. That's the biggest issue I see with employees is they felt like they went to HR for some other issue, and then everybody knew about their issue. So they're really not going to go talk to them about a drug or alcohol problem. So making sure that people are not openly discussing other personnel decisions, other disciplines, those sorts of things, maintaining that confidentiality, I think helps encourage people that they have a safe place to come talk to somebody.
And addiction is really a symptom usually of another deeper soul sickness. I mean, sometimes, for example, our first responder program, a lot of these guys are suffering from PTSD. They're dealing with extraordinary circumstances. They're exposed to a lot of things. They suffer more injuries, so they have more of an opportunity to be put on opiates and painkillers, and it turns into addiction. But a lot of times it's really other issues that and it's coming out sideways, and people start self-medicating, and it doesn't start out like nobody wants to be a drug addict. Trust me. It's a really miserable life. You know what I mean? So anybody says that they can quit if they want to, trust me, it's not that simple for everybody to be doing it. But the idea is we offer people an opportunity to get well, and anxiety, stress, fear, all these things contribute to addiction. That's why many people start when they're in their teens, right? When you're all stressed out and your hormones are raging and you don't know which way's up and everybody's pressuring you to get well and what are you going to do with your life, and people just slide into it. They drift into it. So the idea is there is a solution, and addiction really is, a lot of times the medication part of it is just a symptom. You got to get to what's really bothering you, and that's part of it. At our center too, like we do hypnosis, we do a lot of outside the box stuff because we want to give everybody an opportunity to get well. And we all react a little different to different stimulus. So everybody up here has a different take, but there is evidence-based solutions that are what everybody really needs. How we get there is the massage of the whole situation.
We spoke a little bit earlier about the opiate epidemic. How has that changed the workplace and also treatment in addressing that epidemic?
I mean, from a treatment perspective, I think the drugs have definitely become stronger. Fentanyl is something that's really being introduced, and I don't know how many people are familiar, but it's lethal in very, very, very small doses. So I think the drugs, and again, this is the trend right now, is, Oxycontin and heroin and opiates and things like that. I think treatment-wise, it's definitely bringing a younger generation into treatment, and not that it hasn't been younger, but it's really forcing us to create specific tracks to treat younger adults, to treat older adults. We have a trauma track. We have a chronic relapse track for those individuals who tried many a times, maybe have had some significant periods of recovery and, continue to go back. So it's forced us to be innovative in how we provide treatment, think outside the box, and then just make sure that we're tailoring our treatment to the needs of individuals coming in. Employees is just one kind of quote around a population. People overall are struggling. There's definitely an epidemic, so to say they're not in the workplace would be a complete understatement.
How much of it is that it's a lot more acceptable to go to your doctor and say you have a backache than it is to go down to Newark and try and find a dealer to buy something.
So again, I'll toe this nice line. I think what the opioid epidemic did was it put on the radar how accessible, certain medications had become. And, from people we trust, doctors and things like that. I always tell a story of getting my wisdom teeth, pulled, and Tylenol with codeine wasn't even an option. And now it's, 30 perks for, a month's supply. So again, it's not to be accusatory or blame anyone, but I do think the nature of addiction has changed because of the accessibility of certain medications. Typically if you have a high school injury, and we see this a lot, and you're prescribed oxycodone to treat that injury, a lot of the times we will see the progression into heroin or more, dangerous street drugs because it's addicting, and they become addicted relatively quickly. So, I'll stay off the doctors. I won't beat them up too much. But I think the idea is that the nature of this disease has changed because of the accessibility of addictive substances. So,
and Dawn, there's some interesting specific legislation that was put into place in New Jersey to help remedy this. I mean, we have a 5-day limit on prescribing of opiates for the first prescription. We have a requirement now that a conversation has to take place between a physician or a dentist and the patient or the parent of patients under 18 to share with them the addictive quality of the drugs and also any non-opiate alternatives that are available. And those were really important steps in addressing the opiate epidemic in New Jersey.
And doctors really being responsible for ensuring that an individual isn't going to multiple doctors to receive various medications.
Sure.
So legislation is put in place. Doctors have to register on a portal where they essentially can see the prescriptions that were written for medications across providers.
That's right.
So, I'm not sure without an epidemic of sorts that we're not bringing this legislation to the forefront. So I'm glad that it's happening, but we absolutely have a lot more work to do.
And Brian, what's the links between opioid and a heroin user? What's the relationship there?
It's dollars and cents like everything else. When my prescription runs out and I'm getting a Percocet, or not a Percocet, but an Oxycontin, it's about $40 on the street.
Yeah.
I can go buy myself a bag of dope now for $5. $5. And typically what happens is the person comes in, they get prescribed an opiate, they get hooked, the prescription runs out, or they can't afford it, or whatever happens, and one of their dopey friends says, "Oh, why are you spending that kind of money? You can get a bag of dope for $5, and it's pure enough to snort. You don't have to shoot it up." So now I'm snorting 5 bags a day, and then they say, "Okay, well, you're wasting all that good dope. You could be shooting it, and you can only have to shoot 2 bags a day. Now I'm shooting 10 bags a day." So it's just a progressive terminal disease. It's a disease, and it's not a respecter of anybody's socioeconomic background. And the point that I want to piggyback off of Dawn said, about being in the workplace, NIDA says that 70% of the people with an alcohol and drug problem in the United States are employed. They are in your businesses. They are on your streets. They are your neighbors. They're not the guy living under a bridge. That might be him too. But the idea is it's our loved ones, and the idea is we want to give everybody an opportunity to get well, but you can only be as honest as you are aware. So that's what this is about, raising awareness.
And Dawn, you mentioned the quickness of somebody becoming dependent on opiates. Right now, the recent studies show that as little as 5 days of opiates dependency can begin. And if a person is on an opioid for 7 days, they have a 1 in 7 chance of becoming addicted within a year. If you're on an opiate for 30 days, you have a 1 in 3 chance of becoming addicted for a year. And hence we have this huge epidemic because it was so easily prescribed for so many years.
And Brian pointed it out. I mean, it's a physical, mental, emotional addiction. If you're on 5 days of oxycodone and you run out on the 25th day, and you can't get more, your brain's telling you more, more. It doesn't stop because the prescription's up. It's not like Tamiflu, you're clear of symptoms and you're good to go. And it's really unfortunate to watch, as treatment providers, as people who advocate tirelessly to get more legislation. And, I think the awareness key is key. Like, the individuals are struggling every single day around you. They're not, I do get that there's this very typical picture of what someone with a substance use disorder looks like, and that's not what it is. So, I think forums like this and panels where we can get the information out and come to workplaces and educate and provide some support is really important, because the problem isn't going away, and it's right in front of all of us to help and come up with the solution.
Kelly, how important is education for employees, and how could we do that?
I know we've touched on that a ton. We need to educate employees, not just for obviously employment reasons, but for their family and friends as well. I mean, one person asking someone if they're okay or if they need help can change that person's life. So a father just recently posted about his son dying. He was 44 years old and he was doing well for a few months. He was golfing with his friends the day before. I mean, is that your picture of what people think of when they think of that heroin addict? In the khaki pants, polo shirt,
Right.
looks gorgeous. We have some of the best looking people come through treatment. You would never know. So just at one time, one person saying, are you okay? If it's in your office or if it's in your personal life, could really change someone's life.
We're going to spend a few more moments with some questions, and then we're going to open it up to the audience. Brian, you talked about the bottom line to the employers. What about insurance premiums? How is it impacted when someone has or doesn't have a policy in place?
Well, we know that insurance premiums have been rising about 5% a year for the last several years, which is really unsustainable. And now you take somebody who's got a drug or alcohol problem, and it's $30,000 to send them away, and they have an 80% chance that they're going to relapse. And then depending on your policy, like you're talking about, you might have a zero tolerance. We sent you away.
Yeah.
We lived up to our obligation. You're gone. You just lit that on fire. So the idea is we've got to get to the point where we're, like I said, thinking outside the box and providing people early warning tools so they can get off before they hit that point, before they're unsustainable. The treatment industry is kind of funny, like a lot of other industries. It's not, because you fail up. You know what I mean? You fail up. All of a sudden, like you call your insurance company and say, I want to commit, I have a problem. I want a 28 days treatment. They'll say, well, maybe we'll send you for an assessment, or maybe we'll send you to detox. Maybe. Or we'll send you in there, you start at OP, and then you fail at OP. Well, you didn't die,
Yeah.
so now we'll give you an extra day.
So
You
true.
didn't die, so we'll get you an intensive outpatient. Well, you didn't die. In the meantime, your loved one's suffering, your employee's suffering. So the idea is we've got to get to the point where we recognize this as a treatable disease, a potentially terminal progressive disease. Nobody gets better, you only get worse over time without treatment. So just from a humanity standpoint and from a business dollars and cents standpoint, if you want to keep those insurance premiums down, again, like I said, the product that I developed is really a digital product, so people can get in there who, everybody doesn't have 5-star insurance. You're the Walmart employee who's got crummy insurance. You're somebody who doesn't have any insurance, or you're a self-insured union. This way people can get some type of an education, it doesn't replace detox, it doesn't replace treatment. But what it does is it gives everybody an opportunity. Sam just said that 96% of the people in the United States of America who need treatment aren't getting it. Only 4%, and it's $35 billion we're spending to give 4% of the people treatment. So the idea is we've got to start expanding it for everybody. We've got to start thinking outside the box, and that's really what we're here for. If you guys got a great idea, I'm all ears.
I will also say, so even though we've talked about maybe EAP programs that might increase your insurance costs and those sort of things, there is a savings on the other end. If you do have a drug and alcohol policy and it qualifies under certain things under New Jersey's rules, and you have it in place, and it doesn't necessarily have to be a zero tolerance policy. It can be, but it doesn't have to be. But you have it in place, you test for the things that they want you to test for. You can get a deduction off your workers' comp premiums. You can get about a 5% reduction off your workers' comp premiums.
I just want to go back to the reasonable suspicion testing. What happens if you suspect that someone is under the influence and you want to be able to get a test done? Do you allow them to go and get a test independently? Are you responsible for escorting them to a testing facility if you have that reasonable suspicion? What does an employer do in that situation?
I get that question a lot, and it's like, oh, we sent them for testing. I'm like, what do you mean you sent them? Like, who took them?
Right.
Well, we let them drive.
Right, they're drinking on the job.
You think they're under the influence, but you let them drive. Like, no. So a supervisor needs to escort them over to the facility. I have had people refuse to go for testing. And that's dealt with differently under a disciplinary issue. But I had a question. We have this person and they're refusing to go, and we think they're under the influence and they're insisting on driving. And I'm like, they cannot drive. I was like, you tell them that you're calling a cab for them or you're calling a family member for them. And if they insist on driving, you're going to have to call the police.
Right.
Like, you cannot let them drive if you think that they're being impaired.
Mm-hmm.
Thank you. We're going to open up now for questions from the audience. So who has a question? Yes, this young lady with the green shirt. There's a microphone coming right over. Just 1 second.
Thank you. My name is Susan Weinstein. I'm the manager of the EAP at Penn Medicine Princeton, so always happy to talk about EAPs. And they are separate from insurance. Sometimes insurance companies kind of add on a little EAP. It's kind of a little afterthought, but EAPs are tremendously helpful to organizations of any size. But I just want to make the point, one is that they're very separate from insurance companies. They're a separate benefit. And then in terms of the return on investment, a lot of studies have been done, but I think the largest scale study has found that for every dollar an employer invests in an EAP, the return is about $15.
Wow.
And so they're tremendously helpful.
That's great.
Excellent.
Yeah.
Thank you.
Yeah, you're welcome.
Yes.
Brian, just to follow up on the insurance issue, I would imagine that most major health insurers cover substance abuse, although I don't know that. And a second question, second part of it is the coverage, in your opinion, adequate? Do they cover both inpatient, outpatient treatment programs? And one other component, for employers who don't have health insurance, and they have a lot of either minimum wage or low wage employers, and their only health insurance is the Affordable Care Act. Does the Affordable Care Act cover any of this substance abuse? So thank you.
Well, I'll start with a resounding no. All right, it's very difficult. It's one of the frustrations that people come in with. Really, I'll use our first responders again. A lot of them come with gold-plated insurance, and it's very. I'll tell a true story. We had a gentleman come in. He left detox. He was on a suicide watch. He was there. Came in. We tried to get him into our program. He had excellent insurance. The insurance company says, well, we're not going to cover him. And we're like, well, this guy was just trying to off himself. You know what I mean? He's got an alcohol and drug problem. They said, well, we think he probably got better. It was 2 weeks ago. True story.
Cured.
True story, right? Okay, so we're all in agreement with this. Insurance companies are in the business of selling insurance, taking the money in and refusing to give it out. That's the business model. You know what I mean? And I'm not here to kill insurance companies. I have insurance. I do business with them every day. I thank God they're there because it helps a lot of people. But it's very difficult. It's not like I walk in because it's a chronic disease. It's not something that's going to come in. I got a broken arm. I get it. It's acute. I get it set. It's done in 6 weeks. I walk away. This is something that's like diabetes. It's going to keep coming back around and around. It needs daily maintenance. So that is the biggest issue. And if you want to go to your state legislators and really talk about something that you can do for your fellow man and for your business, have these insurance companies cover treatment, because the quicker you can get it in, and I went to treatment one time. I got good quality care. I followed their suggestions. I did it on a daily basis, and I still do the same things I did 28 years ago. That's why I'm sitting here. But the idea is, if you let people go down in the fail-up model, like I said, we send you to detox. You've been shooting 20 bags of dope for the last 6 weeks, and all of a sudden you walk out the door. What do you think is going to happen? All of a sudden I'm cured. I'm going to run right back and get what I had again. So the quicker we can get people in and send them to quality care, get them in, get them educated, the better chance we have of not just saving lives, but saving everybody money, including the employer on their insurance premiums. Because every time they send out, it costs you. Your premiums go up, and the return on investment stinks.
Kelly, how do you deal with insurance? Sorry.
Yeah, sorry. As you can tell with trends, as the need for treatment rises, as the relapse rate. So patients are coming back to treatment more than ever. So the cost to an employer when that starts happening is tremendous, because it's not, kudos to you, Brian, one time, it's 7, 8, 9, 10 times. And, the insurance issue is something that is definitely a struggle. And I always ask people personally, if you've been doing something for 10, 20 years of your life, and they say you have 20 days to change it completely, you'd look at them and laugh. You would just look right at them and laugh because it's not enough time. And, you know, that's the struggle that we have, even with the most intelligent human beings that go out and follow a program and work the steps and stay in a long-term recovery program. That's a short period of time to make tremendous life changes.
I had my, real quick, I had my lights go out a couple weeks ago. I live up in Sussex County, way out in the sticks. The tree fell down, knocked it. Now I know the lights are out. I walked in my bedroom 4 times in a row and hit the light switch on because it's a habit.
Sure.
Addiction is a physical, emotional, spiritual disease. It's more than just, it's a compulsive habit. You know, I knew the lights were out, and yet I did it over and over and over again. It was on automatic pilot. I didn't even think. That's why people need time. You need time.
I just want to follow up on that from an employment-related standpoint. So anybody that's has 50 or more employees and is covered by the FMLA, an employee could get up to 12 weeks of leave in a year. So maybe it's 28 days is the first one. Maybe they still have time. Maybe they have a more intensive inpatient and they use their whole 12 weeks. That's not the end of the story. And if you aren't covered by FMLA, you can't just say, nope, sorry, I'm not giving you the leave, because being a recovering drug addict or alcoholic is a disability. So you have to engage in a process to see whether or not you can accommodate them. So you're required as an employer to give a reasonable accommodation that doesn't create an undue hardship. Now, if somebody comes to you and they say, I need to, you know, I've been inpatient, I think I have to go back again, nobody knows when I might be able to return to work, if ever, I'm not saying that's something you have to accommodate. But if they come to you, even though you're thinking to yourself, this is the 3rd time they've gone to rehab this year, I'm not doing it. Like, it's the 3rd time I'm not doing it. They had 3 chances, they're out. You have to go through the interactive process. You have to see how much time do you need. What would I do to cover you? You know, you have to actually go through the analysis of can the absence be covered without creating an undue hardship. The fact that you have to schedule other people or it's inconvenient is not an undue hardship. You have a position that you really can't fill unless you get a permanent employee in there, then that might be an undue hardship. You've got to pay temps, you know, twice the hourly rate that you would have to pay this person. You've got to pay overtime. Those might be undue hardships. The fact that you're annoyed that this person needed 3 trips to rehab is not going to be an undue hardship.
Yes. We have some other questions here. Yes, please.
Yeah, I was going to bring up the matter that most of my clients are under 50. That means the entrepreneur who is running it is watching every dime. Mm-hmm. He watched the insurance go like this. He watched everything. And when I come in and suggest to him, this is what we have to do, I don't have the time. I don't have the money. What am I required to do? And how much leeway am I allowed in allowing them not to go 3 times or whatever they may end up doing?
Like I said, every situation is different, unfortunately. I can't give you a bright line test because the law requires each time to be an individual assessment. So you're gonna, one of the things that's helpful in those situations is figuring out what is the job duties, what are the essential functions, because some of it might be, do you have to be able to work overtime? You know, we're short-staffed, you have mandatory overtime, and somebody's saying to you, I'm not going to go to inpatient, but I want to go to intensive outpatient, and I'm going to be gone from 6 to 9, so I can work 40 hours, but I can't work overtime. So those things, having those job descriptions, seeing what is and is not an essential function. You can't just list every single thing they do all day long as an essential function. It really has to be an essential function because you're not obligated to remove an essential function as an accommodation. But the other thing is that, like I said, it's a very frustrating conversation, and I have this a lot with employers because I happen to have a particular niche in like FMLA and disability issues, is I can't give you, yep, you can give them 6 months of leave and that's it. It may have been last year for that exact same employee, you could give them 6 months of leave. But for reasons this year, you're down 3 other people on the staff, they're your sole payroll person, you can't get somebody else in, maybe you can't. So you really do have to objectively evaluate what is going to be the cost of covering for this person while they're out getting treatment.
I think there's a question in the center here. Yes.
So you have been mentioning about FMLA. What about short-term disability? We know that FMLA protects their job, but it's unpaid. So
Okay,
it will be
right.
a qualifier.
Short-term disability is just a benefit. It does not provide for leave. So unless you're an employer that right now it's 50 or more employees for FMLA, and FMLA covers your own health condition. New Jersey family leave does not cover your own health condition, but it would cover your spouse is needing treatment and you need to be there with your spouse. You know, maybe it's some intensive therapy or something, sessions you have to go to, those types of things. You just need to care for your spouse. Your spouse is in the hospital under detox. Come July 1st, that threshold gets dropped in New Jersey down to 30 employees. So if you have 30 employees come July 1st, you're going to be subject to the New Jersey Family Leave Act. Again, it doesn't cover the employee's own illness, but it would cover a family member's as well.
There's a question back.
Hi, my name is Keisha, and I would like to first say thank you for coming out in your time and bringing awareness to us. But my question is for Brian. Brian, you stated that a lot of times when the individual come in for treatment, whether it be in or out, that some of them do relapse. Now, in the event of that taking place, is there a treatment in which that you can allow them to stay a little bit longer? Can the treatment be tailored to the client's needs?
Absolutely. You know, they'll get a clinical assessment and they'll be recommended to an appropriate level of care. But like anything else, you know, and I want to kind of go back, it ties in the same thing. Like once, as an addict, as a recovering person who's a business owner, once you offer this, from a humanity and from an economic standpoint, I do well to offer these type of services to my employees. It makes total sense. But under no circumstance, if somebody doesn't make the commitment to do it the right thing, to stay in recovery, am I responsible for carrying somebody? Because it does them no good, it does me no good. We've all heard of tough love, and I'm not saying tough love. I'm just talking strictly from a humanity standpoint. If I draw a line in the sand and I say, I'm giving you an opportunity to get well, and then you choose not to accept it, then that's your choice, and it doesn't mean, you know, you're a bad person, or it just means it's not a good business agreement for both of us. But, you know, as far as what you're saying, yeah, at our facility, we put somebody on contract, we give them a plan. If they don't wind up being able to keep their commitments to their recovery and to themselves, then we recommend them to a higher level of care. And that's really how it goes. But just, again, if somebody doesn't mean business, the best thing you can do, I'll tell you for myself, pain was the best friend to change, right? And it's unfortunate, but that's the truth.
And I know we spoke a little bit earlier, but we can maybe elaborate on the fact that outpatient treatment is also something that's very viable and an option to keep the person in being employed, but also getting treatment
and
simultaneously.
Brian hit on the best. I mean, accountability is still on the individual, you know, and we have a responsibility to ensure that there's some level of accountability, because you have to be willing and ready. This disease is chronic and progressive. It's a whole lifetimes of work, you know, to stay in recovery and to stay sober. So, you know, you want to provide that individual with all the help they need, and relapse happens. It's a part of recovery for a lot of people, you know, but getting them an assessment they need, making sure they get the treatment they need, but the willingness has to be on them.
If I'm an alcoholic and I have an accident and I kill somebody, the judge isn't going to say, poor Brian, he's an alcoholic. He's going to hold me accountable.
Right.
And that's the way life is. I'm accountable for my decisions. Doesn't mean I don't have a disease. Doesn't mean I don't have a problem. But the bottom line is I am accountable. And addicts and alcoholics who are in the workplace will try, very manipulative people, will figure out a way to push the button, to do what has to be done, to get what I want. And the idea is if you let somebody get away with that, you're not helping that person.
And I just want to add to that too, just because someone's recommendation for treatment is made and that's what they fit the criteria for, it's not what the insurance always wants to cover. So I can say someone needs 6 months in treatment, they might get 7 days.
Say that every day.
So when we ask about insurance, a big question is what plan? Everybody's different. You know, you get offered like your A, B, and C plan. A takes a little less out of your paycheck every 2 weeks. but it doesn't cover as much as it would as C would, or what your out-of-pocket expenses are going to be, because we've seen upwards of $10,000 for a year. That's your deductible before you're covered at 100%. So all of the out-of-pocket costs come up, and a lot of the things, Recovery Centers America, Retreat, we're in network programs, so hopefully those costs will be lower for people than they would if they use their out-of-network benefits, which are still very good for people to use. Everybody should have choices, but we always just want to ask the right questions.
I will also say, piggybacking on what Brian said, that as employers, I get a lot of phone calls once something has been a problem for years. And now everybody's just mad and they want the person fired. And I'm like, whoa, 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 whoa. Yeah. Like, where's the documentation? What steps have you taken to counsel them? What's happening? So even though New Jersey is an at-will employment state, I say at the end of the day, if you get sued by an employee because they're going to raise a discrimination claim, that's what they're going to raise, you have to be able to explain to a jury why you did what you did. So even though I could just say, you know what, I don't like you, you're fired. There's nothing legally wrong with that, but every single juror has had a job, and they want to know that they got a chance. We actually had a case years ago where this employee had 3 times the CEO, she was a lower level management employee, but 3 times the CEO had interfered and stopped her termination because he felt like she went about things the wrong way and she was a little combative, but she always had the company's best interest at heart. And finally, on the 4th time, he was like, I'm out. I'm not going to interfere. You want to terminate her, you're terminating her. The jury actually got to ask questions in that case, and although we laid out this whole history that he had saved her 3 previous times, what they wanted to know was on this 4th time was she warned that if she didn't get on board with the program, she was going to be fired. So we had to put the CEO back on the stand to testify that yes, she was in fact warned. So what happens is, oftentimes you do feel very sympathetic for somebody that's struggling. They're going through a divorce, they lost a child, they have, all these horrible stressors. You suspect that they're using drugs or alcohol, and everybody sort of skirts around the issues. Mm-hmm. So they let the productivity issues slide, they let the disciplinary issues slide until you have a full-blown crisis. So I'm not saying you have to, crack down on somebody in the very first time and discipline them, but I'm saying you need to stay on top of it before you've gotten to the point where you're 2 years in and now you're just done.
Yes.
Follow-up
question? Sure, of course.
The individual is coming out for treatment. Are you making some suggestions for the family as well? Because a lot of times when that individual is going through whatever they're going through, the disease, their family has been going through a lot of things as well. So are you offering some type of treatment to them as well?
Absolutely,
Yeah. Right.
Absolutely. I'll share some of my own experience again. I'm married to the same woman for 42 years, okay? And I was 13 years married when I got sober. And she was actually going for help before I went for help. So what happened was she changed, then I changed, then our relationship changed. If the whole family's not included, I'm a huge proponent of family involvement, because typically what works with an addict and an alcoholic is just the opposite of what you really want to do. You want to save them, you want to help them, and it's really not, we're in the truth business. You tell people the truth, you let them make their decisions, and that's how it works. But had it not been my wife getting help and going and taking care of her own self and not being an enabler, not co-signing my nonsense, I probably wouldn't be sitting here now. So when somebody comes to our facility, after they get their assessment, the next thing we do is we said, okay, who's coming to our family group? It's immediately scheduled. It's that important. Because when one person changes in the relationship, the whole relationship changes.
And same with us at Recovery Centers of America. We contact the loved ones from point of admission. Within 72 hours, the clinical team, their counselor, is calling, setting up weekly family sessions, whether it's over the phone or in person. Every weekend we have family modules, and family groups, and it's really educating the loved one. You may want to continue to provide support and enable, essentially, because you think you're doing what's in their best interest, but it really gives them a baseline understanding of how the disease operates, how you can support your loved one while they're in treatment, how important it is for the family to get well. So we take, the family therapy and the family involvement is just as much of a priority as it is working with that individualized client.
I think there's a question here in the front.
Hi, I have a feeling this is not going to be a cut and dry answer, but we'll give it a shot. I'm Emily Gray. I'm a treatment advocate with Recovery Centers of America, and I'm often the first call that someone makes, when they're looking to get into treatment, or a family member, or a therapist. And one of the barriers that I often hear right off the bat is the individual is so scared, and they know they need help and they want help, but they're afraid they're going to lose their job for getting help. And from what I'm hearing, it's not a cut and dry answer, but my question is, in those instances, I often want to tell the individual that, as long as there hasn't been a disciplinary problem, if you're honest with your employer, chances are you're going to keep your job. Is that an appropriate assumption? Or I'm just thinking in terms of the discrimination piece, if they come to you.
Yeah, I would love to say yes, that's an appropriate assumption. Unfortunately, not every employer understands their legal obligations. Okay. Certainly, if their FMLA covered, they have an absolute right to use their FMLA leave for any qualifying reason, for whatever. It's not up to the employer. Your job's protected. You're carried on insurance. If you're not in that situation, I like to hope that most employers know enough about discrimination law that you're not in a disciplinary situation. And if your employee comes to you and says, I have a problem, I need to go get help, you are now on notice that that person has a qualifying disability. And if you turned around and fired them because they said, I need help, you could be facing a retaliation lawsuit. So you could be facing somebody who asked for an accommodation and then you retaliated against them. So like I said, I'd like to hope the answer is yes, but not every employer is aware of their obligations.
I have two questions. One was posed from NJBIZ asked readers to write in, and I'm happy to say most of the questions were covered during the panel. One I have is, what happens if another employee reports someone that they're suspicious of? How do you handle that if they go to HR or they go to their manager and say, I think so-and-so has an addiction problem?
I think it depends on what the level of observation is. If it's just, I kind of think they may have a problem, they seem a little off, I'm going to tell a supervisor, keep an eye on that person. I'm not going to jump to do anything. If they come and they say, listen, you got to come right now, like they're asleep, we can't wake them up, that's a different issue. And I've had that, that's a different issue. That's, we're probably getting medical treatment, but we're definitely getting them tested. So I think it depends on how specific the complaints are. One thing that employers don't realize is, so if an employee comes to them and says, I was talking to John and John told me, you know what, I'm having a real problem. I go out to my car every day at lunch and drink a pint of vodka, and then I come back in because nobody can smell the vodka. That's enough basis to send that person out for testing. Mm-hmm. So they don't necessarily have to have been observed to have been impaired. If they've admitted to the fact that they're drinking on the job or using drugs on the job to another employee, then that's something that you could consider.
And encouraging confidentiality. Mm-hmm. Christina pointed that out millions of times, but it can spiral quickly. If you're not kind of letting them know, just keep this between us, or right. No one else needs to know.
Right.
Great. And another question that I have is, we talked about, many of you have said that you'd go to the workplace or you'd educate folks at the workplace. Does that happen commonly, and how can folks in this room have that happen?
From our perspective, I've done it many a times. Emily has done it. We have, a widespread locations, Maryland, New Jersey, Pennsylvania. And the idea is, I'll come out for lunch for an hour and provide an education to the leadership, and as will Emily and everyone on our team. Everyone is accessible to us. So, you can have our information today. We can set something up, even if it's just coming in and what are you dealing with? But I think it's not, first of all, it's typically a disease that suffers in silence. People don't talk about it as readily, more now maybe. But, we're more than willing to come out and provide any trainings, any coaching, any language that you guys can use. So it's just one connect with us, and I'll make sure to provide my information today.
Same here. Full recovery, come out anytime, anywhere, to help anybody.
Yeah, and the partnership also has a program called the 15-Minute Child Break. And it's a program really geared towards educating families about the issue of substance abuse. It's a free program, and we do lunch and learns in many workplaces. And it's a really, I think, an interesting way to be able to approach the subject, because you're not talking about the employee, you're talking about the employee as a parent or a grandparent. And sometimes that's a good way to start the conversation. So, yeah.
Judy, Plastomatic Valves. We have larger equipment, so that was one of the things that were brought up before. Our concern right now is the cannabis legality and how that's going to be really difficult, because people can go out and eat gummies and they're going out on their break, and you can smell pot, yes, you can smell booze, yes, but you don't know if they're ingesting something. And we don't know what's going to happen. What are our boundaries? How do we know that? How can we test those people when we know it's going to? You can kind of pick out a couple of people. I know you shouldn't, but you kind of know who they were, and I don't know how that's going to affect us.
Right now, the current law in New Jersey is still that medical marijuana is the only acceptable use of marijuana. The decriminalization bill that was supposed to be voted on yesterday didn't get passed from the Senate. So right now we're still dealing with that. The medical marijuana law specifically says that employers do not have to accommodate use in the workplace. There was a bit of a question, which hasn't been 100% resolved, but we have a little bit more answer as to what happens with sort of pre-employment testing, because what the law says is employers don't have to tolerate employees being impaired at work. So the question is, what about pre-employment testing? Because they're not working, But there was a district court case in New Jersey in October that came down and said, we don't care, you can apply your uniform pre-employment testing. Right now, that's the current law. I will say this, I've done several webinars on medical marijuana, I've been on other panels with medical marijuana, and I think we all have the same experience, and I think Brian and Kelly and Don can say the same thing. I personally don't know that suddenly your entire workforce is going to be using marijuana. I think the people that were already using marijuana are using marijuana.
Right.
I think even if it got fully legalized, you'd have a very small percentage of persons. And what I say to people is, when you're considering your medical marijuana policy, is it really any different than somebody who's on oxycodone or Percocet? You know, are they the same level of impaired, possibly?
So we have time for one more question. And
I hear your answer. I don't necessarily totally agree with you. I think it is very costly with the legalization of marijuana or any drugs. I think what is happening is, if you look around the country and read what's going on, the medical bills are rising. Police departments, which can't even afford to have modern equipment today, can't afford to upgrade it to what's necessary to deal with. Now they have to judge what's a drunken driver, what's not a DUI. It's very, very expensive. I think the best prevention we could do is prevent the legalization. As a parent, as a grandparent, and watching it in the business environment, all you're doing is inviting trouble. We live in a country right now, in certain states, certain parts of states, you can't even ask what an individual was making in their last job. And now we're going ahead, it's legalized. You're looking for trouble, and the only thing we can do is prevent it from occurring.
Right. I'm not advocating for legalization or not legalization. What I'm saying is, I think that people who are currently using marijuana are still going to be your current users once it's legalized. I think there might be a percentage of people who said, it's just as easy to buy pot as it is to drink, but I don't think that's common. I think you already have marijuana users in your workplace. So
I know we said one question, but that wasn't a question, so we'll allow this gentleman. This gentleman over here with the shirt. No, that's okay. I think this gentleman has a question with the blue shirt.
My question is, you say somebody saw him drinking, reporting him drinking. What if an employee comes up to you and says, well, I smell it on his breath? Is that enough to send for testing?
I would have the supervisor go. Your supervisor should be trained in how to recognize the symptoms, how to deal with reasonable suspicion. So your supervisor should go and verify. It should be documented. Don mentioned that earlier. that I detect the odor of alcohol. Any physical symptoms should be documented. The bloodshot eyes, slurring words, having trouble with their gait, staggering, anything that would be a physical symptom. The supervisor should also have a conversation with that employee. What's going on? Document the conversation, and then the supervisor should escort them over for testing.
This is why the training is so important. Because this is happening nonstop all over, and no, I don't think everyone's aware of how to have the conversations and what to look for.
I think the other problem is, as we increasingly have workplaces that aren't 9 to 5, it's far more difficult to deal with these issues when they come up on the night shift at 2 a.m. And all of a sudden, your supervisor's in a panic, and they can't get a hold of anybody in HR because it's 2 a.m. And they don't send the person out for testing. And then it's 8 hours later, and they're kind of like, well, we think he was drunk last night. I'm like, well, too late now. Like, you're not doing anything with that. So it's, again, as Dawn was saying, it's important to have them trained.
And I do want to mention one thing about testing for alcohol, especially, because a lot of people think that you can't detect it maybe a day or two later. There are some urine screenings now that you can detect if alcohol was, in fact, ingested. Other than breathalyzing and stuff like that.
Have you all dealt with the saliva testing for marijuana?
Not yet.
Not yet? Okay, because I only ask because that becomes a question for certain employers in certain states that say you can't penalize, Arizona's one, you can't penalize somebody just because they had a positive marijuana test.
Right.
You have to be able to demonstrate they're currently impaired. So there is, as I understand it, a saliva test that will actually test for THC and not the metabolites, but I don't know anybody that's used it yet.
We're not using it.
Yeah, okay.
Okay, what we're going to do at this point is we're going to ask each of the panelists to leave today with a takeaway for each of you. I think that's very important and something that specifically you can use in your own businesses. So do you want to start with Donna?
Sure. I just want to close by saying, obviously we'll have conversations after this, but at Recovery Centers of America, we're available 24 hours, 7 days a week. You know, if someone calls 1-800-RECOVERY, a live person answers the phone 10 seconds or less. It's not an operator, it's not a voicemail. So if you know someone who's struggling or want to link someone up who's struggling, you can call today. But it does seem, just from this panel, like the training and education piece is vital, and we really want to be able to afford that to you too. You know, it's a hard conversation, but it's a needed one because there's cost to employers and businesses that they're not even realizing when the conversations can happen a lot sooner. So, you know, we just want to be a valuable resource for you. And, you know, if you know anyone that's struggling, we're one call away.
Thank you.
Christina? And I would say, just sort of piggybacking on our conversation, when you said the best thing is prevention, that's true of policies too, any policy. Whether it's substance abuse, whether it's your vacation policy, your sick leave policy, any of those things that, and I know a lot of employers sometimes get lost in not doing policies because they're very busy running their businesses. But if you can take that time to think through, what do I want my policy to look like? What am I concerned about? Am I concerned about my workers on the assembly line? Do I care if somebody has medical marijuana? Do I not? And you actually take that time to do it before you have a problem. You're going to have a lot more seamless application of your policies, and you're hopefully going to have less productivity issues in the workplace.
Brian?
Thanks everybody for coming, and Karen. What I'd like to say is we have a treatment facility, you know, in New Jersey, and there's no substitute for treatment. The reason we've come up with Freedom 365, our digital platform, is so that more people can get better information and get off the elevator before they hit the bottom. Education is key. Like I mentioned, people who have substance abuse problems use 7 times the health care, and their spouse or their loved one uses 3 times. So the idea is to get the education out there to help the person who's the caretaker in the family get over this challenge is so important. And rather than lead with the chin, as they say in the prize fighting ring, you know, going with a $30,000 to $50,000 investment, you know, for pennies a day, you can get your employees the information they need to make their own decision.
Kelly?
And, you know, piggybacking off of everyone, education, education, education. Information is not the enemy, and we just want you to know that at Retreat Behavioral Health, we're here to help you. So whether or not someone can come to us or not, if their insurance works or not, that's not our main question. We want to know how we can help you and that person get the services they need. So we want to be your partner. That's our big advocacy in the communities and with other employment agencies, other treatment facilities. We will get you where you need to go safely.
Okay, and I just want to leave inviting everyone to sign up for drug-free workplaces, which is a free program, and it will be able to provide quarterly updates on legal issues. And also Tuesday, April 9th, there's a legal issues seminar, which is also free for anyone who's interested in attending, and we have information as well available to each of you. I want to first thank our panel. Let's give them a great round of applause. We want to thank each of you for taking time today to come and be part of this conversation. And finally, we want to thank New Jersey Biz for hosting this, and I want to ask Jeff to come up and close today's event. Thank you.
Thank you, Angelo, and thank you, Kelly Efchak, Brian McAlister, Christina Stoneburner, and Dawn Belamarich. We have one more takeaway for you. That's Brian's book. We have copies available near the exit, free of charge. The title is Full Recovery, The Recovering Person's Guide to Unleashing Your Inner Power. Please pick one up if you'd like to do that. As always, we will have full coverage of today's proceedings on njbiz.com later today and in our print edition next week. Our next panel discussion is on April 30th, right back here at the Doubletree on construction and development. I hope to see you there. Thank you all for coming. Have a great day.